Our next guest says that visceral fat is one of the worst health issues facing America right now. And that doctor is Dr. Sean O'Mara, and he joins us now. So Dr. Sean O'Mara, thank you for joining us. Bobby Kennedy's on this diet. I've talked about it. My husband's on it. I'm on it. Kind of.
When we're not doing Italian food segments.
Exactly, when we're not doing Italian food segments. Tell me why this is so important, this visceral fat diet. What is the danger?
So what's interesting is that there are over 25,000 published studies connecting visceral fat to disease. And the sad thing, almost nobody knows about it, including physicians, because it's really not part of the curriculum in medical schools, but it's better thought of as a disease inside your abdomen and within your body. So it contributes more to mortality and the loss of health than anything else you could find in a scan. So it's becoming popular, and thankfully the Secretary of Health is contributing to awareness about visceral fat, especially in how he's eating. So how you eat really influences the amount of fat that you have, this dangerous fat inside your abdomen that also extends around your heart. So diet plays a role, but so does alcohol, stress, the amount of sleep you have. There are a lot of influences to visceral fat. But what's important for America to understand is, first of all, the awareness about visceral fat, learning how to become measured in terms of your approach to it by taking a look at what's inside of your body. And that's where physicians can be helpful in using MRI scans that are done to illustrate this fat instead of having this abstract concept that you have belly fat. You really need to see it.
I know that the word fat can mean different things when it comes to diet and nutrition, as well as how you look. I did a version of a keto diet a while back, and it was very similar to carnivore, except it brought in things like nuts and even something like maybe beef tallow. How did those factor into a diet like this?
What is this diet?
So
why don't you just tell us the diet?
Yeah, fair enough.
Sure. So the diet that we have found after studying this for about 13 years that works the best is basically a meat-centric diet with fermented vegetables and fermented fruit. So when you eat basically the most nutritiously dense food known to man, which is meat, and you want to eat the healthiest form of that meat, along with fermented vegetables and fruit, you contribute to your microbiome, making your dietary contribution to your body optimally more healthy. So it's eating what I call the living carnivore diet. So meat and microbes chewed together. You eat meat with these fermented traditional foods that we have seen, Rachel, for thousands of years have been consumed by traditional people, now catching on in modern times, and people dramatically losing weight. But I like to say losing disease.
Yeah.
Because when you lose visceral fat, you're just not losing weight. You're losing disease inside of your body and around your heart.
So it's doctor, really quick, because we don't have a lot of time. Tell me if I'm wrong. Meat, kimchi, or not coleslaw, but what is it? Sauerkraut.
Sauerkraut and yogurt and kefir. Exactly right. Fermented foods are kimchi, sauerkraut, fermented beets called kvass, fermented carrots, yogurt, fermented dairy, even blue cheese and roqueforts that have been around for thousands of years help contribute to your microbiome.
Yeah.
Awesome.
You'll see the weight just literally fall off. It's incredible.
Dr. Sean O'Mara, thank you so much for joining us.
Thanks for joining us.
My pleasure.
You got it.
Hey, it's Will Kane. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Kane podcast for full episodes right now.